Okay, so let's start. So the first question is, what is the fifth vital sign? Option A, swelling. Option B, pulse. Option C, pain. Option D, breathing. What is the fifth vital sign? Option A, swelling. Option B, pulse. Option C, pain. Option D, breathing. Shall I repeat the question? Make sure you have only 45 seconds, okay? What is the fifth vital sign? Option A, swelling. Option B, pulse. Option C, pain. Option D, breathing. Okay, time permits. Now, guys, please stop discussing the time permits. Now, this question is passed to the team. Yes, introduce your team. Okay, 5-star. This question is passed to you. You also got only 45 seconds to answer this question. Shall I repeat the question? What is the fifth vital sign? Option A, swelling. Option B, pulse. Option C, pain. Option D, breathing. Let me remind about the 45 seconds. Okay, C, pain is your answer. Yes, it's a correct answer. You got your 5 bonus points. Now the next question is again asked to you. Are you ready? Okay. What is cholecystitis? What is cholecystitis? Option A, inflammation of uterus. Option B, inflammation of kidney. Option C, inflammation of urethra. Option D, inflammation of gallbladder. Option D, inflammation of gallbladder is your answer. Lock कर दिया जाए. Let's see. Yes, it's the correct answer. You got the 10 points. Okay. Now the next question is to the team monster. Who is the chairperson of Sexual Harassment Committee? Option A, Mr. Amit Tubaria. Option B, Ms. Kamal Juneja. Option C, Dr. Oshargar. Option D, Mrs. Chigna Kalaria. Option D, Mrs. Chigna Kalaria is the answer. Okay, let's see. Yes, it's a correct answer. You got the 10 points. Now it's your turn. You ready? Okay. Who is the member secretary of safety committee in our hospital? Who is the member secretary of safety committee in our hospital? Option A, Mr. Hitesh Chawla. Option B, Mr. Narottam Menpara. Option C, Mr. Ravi Padalya. Option D, Mr. Ravi Parakya. Shall I repeat the question? Okay. Who is the member secretary of safety committee in our hospital? Option B, Mr. Narottam Menpara is your answer. Okay, let's see. Yes, it's the correct answer. You got the 10 points. Okay, now the next question is to you guys. Are you ready? Ready? World AIDS Day celebrated on. World AIDS Day celebrated on? Option A, 12th May. Option B, 15th Feb. Option C, 10th December. Option D, 1st December. Option D, 1st December is your answer. Okay, let's see. Yes, it's a correct answer. It got a 10 points. Well done, guys. Now, the next question is to you. What is oliguria? Understand? Okay, option A. Urine output greater than 780 ml. Option B. Urine output less than 400 ml. Option C. Urine output greater than 400 ml. Option D. Absence of urine. Option B. Urine output less than 400 ml is your answer. Final? Okay, it's a correct answer. Okay, now the next question is to you. Doctor's order says 300 ml of ampicillin sodium 500 mg to infuse over 40 minutes. Drop factor 20 GTT per ml. You got the question in another notes too, so you can easily solve it out with the Cassie, okay? Doctor's order says. You have already given question to understand better. You have only 45 seconds. Okay, let me give options. Option A, 150 GTT per ml. Option B, 152 GTT per ml. Option C, 100 GTT per ml. Option D, 154 GTT per ml. Option C, 100 GTT per ml is your answer. Sure? Okay. Sure? It's a wrong answer. Sorry, guys. But still you tried well. Option A, 150 GTT per ml is the correct answer. So you got 0 points for this question. Okay, now this question is passed to you. Pass the notes.
No, you already asked.
But you give the wrong answer. So this question is just passed to this team for fun only. Not this question is a past question and will not give any bonus mark for this question. So don't worry, this is for fun only. So let's solve just for knowledge. The question is already in that note. Okay guys, the time permits. So I would like to pass this question to audience, just for knowledge. Okay, now the next question is asked to you, right? Doctor's order says Infuse 1500 ml of lactate ringus over 12 hours. Drip factor 15 GTD per ml. Doctor's order says infuse 1500 ml of lactate ringus over 12 hours. Drip factor 15 GTD per ml. 1500 ml infuse 12 hours and drip factor 15 GTD per ml. Okay, option is given. Okay, option D 31 GTD per ml is your answer. Yes, it's a correct answer. You got the 10 points. Okay, the next question is to you guys. What is the full form of RGU? Option A, retrograde urosonography. Option B, retrograde urosepsis. Option C, retrograde urethrogram. Option D, retrograde urology. RGU. Shall I repeat the options? Okay. Option A, retrograde urosonography, retrograde urosepsis. Option C, retrograde urethrogram. Option D, retrograde urology. Option C is your answer. Yes, it's the correct answer. Go to the 10 points. Now the next question is to you. What is the normal urine output per day in adult? What is the normal urine output per day in adult? Option A, 800 to 2000 ml. Option B, 800 to 1000 liter. Option C, 2500 ml. Option D, 2500 liter. Shall I repeat the options or you decided the answer? Okay, option A, 800 to 2000 ml is your answer. Sure? Okay, let's see. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. Which vitamin is essential for blood clotting? બ્લડ ક્લોટિંગ માટે કયું વિટામિન જરૂરી છે તમારે જણાવવાનું છે. ઓકે, ઓપ્શન A વિટામિન A, ઓપ્શન B વિટામિન M, ઓપ્શન C વિટામિન C, ઓપ્શન D વિટામિન K. Option D vitamin K is your answer. Final? Okay, yes, it's the correct answer. You got the 10 points. Now the next question is to you. Are you ready? Okay. Citrus fruits are an excellent source of vitamin K, vitamin C, fat, protein. Citrus fruits are an excellent source of option A, vitamin K, option B, vitamin C, option C, fat, option D, protein. Vitamin C, option D is your answer. Okay. Let's see. Yes, it's the correct answer. Got the 10 points. Okay. Now the next question is to you. 1 tablespoon is equal to how much? Option A, 5 ml. Option B 15 ml. Option C 20 ml. Option D 10 ml. One tablespoon is equal to 1 tablespoon. Option A 5 ml. Option B 15 ml. Option C 20 ml. Option D 10 ml. Option A 5 ml is your answer. Sure? Lock कर दिया जाए? Sorry, it's your wrong answer. So this question is passed to this team. 1 tablespoon is equal to option A 5 ml, option B 15 ml, option C 20 ml, option D 10 ml. Option D 15 ml is your answer. Lock कर दिया जाए? Okay. Let's see. Yes, it's a correct answer. You got the 5 marks or points as a bonus. It's a past question, so you get only 5 points as a bonus. Okay. Yes, guys. Any query? Okay. Now the next question is to you. Fine. Which of the following is an example of non-verbal communication? Option A, facial expression. Option B, posture. Option C, gesture. Option D, all of the above. Option D, all of the above is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is passed to you. Not passed means I will ask you. Don't confuse. Which is the largest gland in human body? Option A, liver. Option B, pituitary gland. Option C, thyroid gland. Option D, parathyroid gland. Which is the largest gland in human body? Option A, liver. Option B, pituitary gland. Option C, thyroid gland. Option D, parathyroid gland. Option A, liver is your final answer. Yes, it's the correct answer. You got 10 points. Now the next question is to you. Bleeding from the nose is known as hemodialysis. Option A. Option B, hematemesis. Option C, hemodialysis. Option D, epistaxis. Okay, option D is your answer. Let's see. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. What is the full form of ECG? Not ECG. EEG. I know. Now the option A is electrography. Option B, electrocardiography. Option C, electroencephalogram. Option D, electroangiogram. Full form of EEG. Option A, electrography. Option B, electrocardiography. Option C, electroencephalogram. Option D, electroangiogram. Option C, electroencephalogram is your answer. Yes, it's correct. Okay, now the next question is to you. A patient who has a pacemaker might be ineligible for which of the following investigation? A patient who has a pacemaker might be ineligible for which of the following investigation? Option A, ECG. Option B, CT scan. Option C, electroencephalogram. Option D, magnetic resonance image. Shall I repeat the question? A patient who has a pacemaker might be ineligible for which of the following investigation? Option A, ECG. Option B, CT scan. Option C, electroencephalogram. Option D, magnetic resonance image. Okay, you permit the time. So this question is passed to this team. Shall I repeat the question or options? Both. Okay. A patient who has a pacemaker might be ineligible for which of the following investigation? Option A, ECG. Option B, CT scan. Option C, electroencephalogram. Option D, magnetic resonance image. Option A, ECG is your answer. Are you sure? You have only 45 seconds. So, option D, magnetic resonance imaging is your answer. Yes, it's a correct answer. You got the 5 points as a bonus. Now the next question is to you. Anuria is defined as option A, absence of create level. Option B, absence of urine. Option C, urine increase. Option D, kidney failure. Option A, absence of create level. Option B, absence of urine. Option C, urine increase. Option D, kidney failure. Option B, absence of urine is your answer. Yes, it's the correct answer. You got the 10 points. Okay. Now this question is last is which blood group considered as a universal recipient? Option A, A positive. Option B, O positive. Option C, AB positive. Option D, AB negative. Which blood group considered as a universal recipient? Option A, A positive. Option B, O positive. Option C, AB positive. Option D, AB negative. Option C, AB positive is your answer. Let's see. Yes, it's a correct answer. You got the 10 points. So here we hand over our first round and it's a complete. Let's see the score. You have to wait it for 2 to 3 seconds because our judges get times to score out the marks. Okay, let's see the score. The team Monster got 75 out of 100 and the team Fighter got 95 out of 100. So today among the ball team, the winner team is the 5-star. So let's give a big round of applause for this amazing, intelligent and beautiful team. Thank you guys. You may take your seats. Now, without wasting your time, I would like to welcome our next team, the team Bright Sparkle versus the team ICU Warriors. Welcome on the dice. Come on. Come on, make some noise for it, guys. Let's give a big round of applause for these amazing teams. Okay, so the team
ICU Warriors. Bright Sparkles.
Okay, the ICU Warriors versus the Bright Sparkle. Are you comfortable, guys? Okay, the first question is asked to whom? So again, we should toss the coin. Who wants the head or tail? Okay, one the head. And are you agree with that?
Yes.
Okay, let's see. Let's see what's again it comes head. Oh my god. Okay, so you win it. So the first question is asked to you. Are you ready? Okay. ECG lead V5 plus D. Option A. Left side fourth intercostal space. Option B. Anterior auxiliary line at the fifth intercostal space. Option C. Mid auxiliary line. Option D. Right side mid auxiliary line, fifth intercostal muscle. Option B. Anterior auxiliary line at the fifth intercostal space is your answer. Are you sure, guys? Okay, it's a correct answer. You got the 10 points. Now the next question is to you. Who is the member secretary of HIC committee? Option A. Dr. Vishal Bhatt. Option B. Dr. Jai Parikh. Option C. Miss Mittal Makwana. Option D. Dr. Dhaval Kotaria. Member Secretary of HIC Committee. You have only 45 seconds. Option A. Dr. Vishal Bhatt is your answer. No? Shall I repeat the options? Okay. Option A. Dr. Vishal Bhatt. Option B. Dr. Jai Parikh. Option C. Miss Mittal Makwana. Option D. Dr. Dhaval Kotaria. Option C is your answer. Yes, it's the correct answer. You got the 10 points. Okay, now the next question is to you. Nursing audit is used to. Option A. Plan for nursing staff. Option B. Assess cost, effective care. Option C. Assess money transactions for nursing care. Option D. Assess quality of nursing care. Option D. Assess quality of nursing care is your answer. Yes, it's the correct answer for the 10 points. Now, the next question is to you. Length of insertion of NG tube is measured from. Option A. From tip of nose to ear lobe, then xiphoid process. Option B. From tip of nose to xiphoid process. Option C. From tip of nose to forehead and to xiphoid. Option D. From tip of nose to stomach. Option A is your answer. Yes, it's the correct answer for the 10 points. Now the next question is to you. Are you ready? 1 teaspoon is equal to how much? Option A, 5 ml. Option B, 2 ml. Option C, 15 ml. Option D, 7 ml. Option A, 5 ml is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question. Which of the following medication ordered is immediately and once only administered? Which of the following medication ordered is immediately and once only administered? Option A, PRN order. Option B, single order. Option C, state order. Option D, standing order. Okay, option C is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. During infection, which among the following value will be elevated? Means cancel out. Option A, PP. Option B, platelet count. Option C, WBC. Option D, APTT. Option C, WBC is your answer. Yes, it's correct. You got the 10 points. Now the next question is to you. Mantoux test is to determine. Option A, measles. Option B, tuberculosis. Option C, AIDS. Option D, diphtheria. Okay, option B, tuberculosis is your answer. Yes, it's the correct answer. You got the 10 points. The next question is, which is the following abbreviation indicates whenever required? Option A, OD. Option B, BD. Option C, PID. Option D, SOS. Option D, SOS is your answer. Yes, it's the correct answer. Got the 10 points. Now the next question is to you. Temperature of hyperpyrexia. Option A, 99.4 degree Fahrenheit. Option B, 100.6 degree Fahrenheit. Option C, above 105 degree Fahrenheit. Option D, above 103 degree Fahrenheit. Option C, above 105 degree is your answer. Are you sure, guys? Final look कर दिया जाए. Yes, it's the correct answer for the 10 points. Now the next question is to you. Blood drawn for a complete blood count is collected in. Option A, plain vial. Option B, EDTA vial. Option C, citrate vial. Option D, chloride vial. Option B, EDTA vial is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to approx. What is the weight of a kidney? Option A, 180 gram. Option B, 260 gram. Option C, 150 gram. Option D, 250 gram. Option C, 150 gram is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. What is the route of administration of BCG vaccine? Option A, intramuscular. Option B, intradermal. Option C, intravenous. Option D, subcutaneous. Option B, intradermal is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is stomatitis known as option A, inflammation of a mouth. Option B, inflammation of the tongue. Option C, inflammation of a bone. Option D, inflammation of the stomach. Stomatitis known as Shall I repeat the options? Option A, inflammation of mouth is your answer. Let's see. Sorry guys, it's a wrong answer. Inflammation of, sorry, I don't want to give answer. I would like to pass it to this team. Okay. So this question is passed to you. Stomatitis known as option A, inflammation of mouth. Option B, inflammation of tongue. Option C, inflammation of bone. Option D, inflammation of stomach. You don't get any bonus points. This is just for knowledge. Option B, inflammation of tongue. Yes, it's the correct answer. Now the next question is to you. Frequency of urination at night is called option A, dysuria. Option B, nocturia. Option C, anuria. Option D, oliguria. Option B is your answer. Yes, it's the correct answer. You got the 10 points. Hemodialysis is a process of, this is a question to you. Option A, adding oxygen to the blood. Option B, extracting nitrogenous waste from the blood. Option C, extracting antibodies from the blood. Option D, mixing blood with essential nutrients. Shall I repeat? Hemodialysis is a process of option A, adding oxygen to the blood. Option B, extracting nitrogenous waste from the blood. Option C, extracting antibodies from the blood. Option D, mixing blood with essential nutrients. Option B is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is the axis used for short-term hemodialysis. Option A, fistula. Option B, graft. Option C, catheter. Option D, shunt. The axis used for short-term hemodialysis. Option A, fistula. Option B, graft. Option C, catheter. Option D, shunt. Option C, catheter is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is, which is the largest vein? Option A, inferior vena cava. Option B, superior vena cava. Option C, jugular vein. Option D, iliac vein. Shall I repeat the options? Option A, inferior vena cava. Option B, superior vena cava. Option C, jugular vein. Option D, iliac vein. Option E, inferior vena cava is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. What is the full form of ADPKD? Option A, autoimmune disease of kidney. Option B, autoimmune disease of per kidney dialysis. Option C, autosomal dominant polycystic kidney disease. Option C, automatic diameter polycystic kidney disease. Option C is your answer. Let's see. Yes, it's the correct answer for the 10 points. Now, the next question is 500 ml of IV fluids needs to be administered over 5 hours. Drop factor is 20. Calculate drops per minute. 500 ml of IV fluid need to be administered over 5 hours. Drop factor is 20. Calculate drops per minute. Option A, 33 drops per minute. Option B, 35 drops per minute. Option C, 38 drops per minute. Option D, 48 drops per minute. Option A, 33 drops per minute is the answer. Yes, it's correct. You got the standard. Okay, today we ended over here. Amazing guys, you played very well. Let's give a big round of applause for this amazing, intelligent teams. Let's see what's the score. Wow, it's a century for IC Warriors. So IC Warrior got 100 out of 100 and the Bright Sparkle got 90 out of 100. So among this board, the winner team is the IC Warriors. Put your hands together for this amazing team. Thank you guys. You have to take your seats.
Final, final so.
Okay, now as you all know that today among the 4 teams we were selected only 2 teams for finals. So that you know, but still I would like to welcome Dr. Dhaval Koteria sir to welcome our final teams. Come on sir, please welcome on the dice.
I like to invite to both team who better this quiz and entering final round. So request to all players, please come on stage. First I invite to IC Warriors. Please come on stage and take your seat. And second team is 5 star. Please take your seat.
This is our final teams. But I would like to take a rest of 1 minute before starting the finals.
લાઈવ પોસ્ટ કરતું લાઈવ બંધ છે ડિસ્કશન થાય ને એક ક્વેશ્ચનમાં છે ને આ લોકોની વાત સાચી છે એટલે જનરલ ક્વેશ્ચન પૂછી લે લાઈવ અત્યારે બંધ છે બરાબર તમને ક્વેશ્ચન આઈડી બંનેને ફરી પૂછી લે લાઈવ બંધ છે ને ત્યાંથી જ આન્સર આપી દેજો વાંધો નહીં અહીંથી તમે માઇક આપી દીધું હા તમે અહીંયા આવો હેતલથી આમાંથી કોણ છે મનીષા ટીચર કોણ છે તમે આવો તમને ડાઉન એક ક્વેશ્ચન પૂછશું ટીમની જ વાત છે અહીંયા આવતા રહ્યો અહીંયા આવતા રહ્યો અહીંયા अरे बंद कर दो ना बोला देखो तुमने बोला हो जाएगा तो बंद कर दो અને લાઈવ નો ભલે ઓડિયો ચાલે એક ક્વેશ્ચન પૂછી લેશું જે ફર્સ્ટ આન્સર આપશે લાઈવ નથી અત્યારે ચિંતા કરો ઓપ્શન નહીં આપવાનું ડાયરેક્ટ આન્સર
જાય અમે જોશું. હું જ છું આ જો. હા બોલો. ખ્યાલ પડી ગયો ને તમે બેન ખ્યાલ પડી ગયો ને? હા હા પૂછી લો વિધાઉટ ઓપ્શન લાઈવ નથી. ઓડિયો તો પોસ્ટ ઓડિયો તો વિડિયો તો પોસ્ટ કરો. અરે વિડિયો ઓડિયો ચાલને દો વિડિયો.
Hello. Now, I would like to ask one general questions to both these teams, and you should give answer without options. Okay? The question is that which is the largest part of the brain, human brain? Which is the largest part of the human brain? Okay. Cerebellum is your answer. Shall I repeat your answer? Pronunciation is must matter.
બોલી ગયા હા બોલો. બેન એક જ વાર હા બોલો હાલો બીજો આન્સર. કન્ફર્મ છે બેન? તમારું શું છે?
Okay, you pronounce it like cerebrum. Sure? Pronunciation must matter, guys, so you should pronounce it properly. Now it's your last chance to pronounce. Cerebrum. Cerebrum. Okay. Now it's correct.
હવે જો એક જ વખત આ પૂછો કરજો અને એક જ વખતમાં આન્સર હશે લોક ગણાશે એટલે કોઈ યાર એવું નહીં. જ્યારે બેલમ બોલ્યા છે ને અંદર નાનું મગજ છે બેન હું તમને સમજાવું એ પાછળનું મગજ છે જ્યારે બેલમ એટલે પેલો આન્સર રોંગ હતો. પણ બેન ટાઈમ ન હોય ને આ એ લોકો હાથ ઊંચો કર્યો છે એટલે જ હું કહું છું જે આન્સર હાથ ઊંચો કરીને બોલશે ને એ ફાઇનલ ગણાય. જરૂર પડશે તો સ્પેલિંગ લખાવડાવે. ડિસ્કસ નો ડિસ્કસ હાથ ઊંચો કરીને બોલી જશો એ બેન સાંભળો પેલા અત્યારે કીધું હાથ ઊંચો કરીને જે બોલી જશે એ આન્સર લોક થઈ જશે ઓટો. જરૂર પડશે તો સ્પેલિંગ લખાવડાવે બે ટીમ. હવે ચલો
Again, I would like to ask one more general questions to both this team to make sure for the winners. The question is, which gland controls the functioning of other endocrine glands? Okay. Pituitary gland is your answer. Yes, it's the correct answer.
સામેની જ ઓફિસ છે મારે.
Okay. So, any problem? Are you ready? Comfortable? Shall we begin? So it's our final round. So I would like to ask first question to whom? To you or to you? This time you decided, guys. Without any quarrel. Okay, to you. First of all, I would like to introduce your team because it's our finals. So you are the bright sparkle and the versus the 5 stars. Okay, so let's start. I would like to ask my first question to the bright sparkles. So the first question is CPAP stands for option A, continuous permanent airway pressure. Option B, continuous positive airway pressure. Option C, continuous prolonged airway pressure. Option D, continuous passive airway pressure. Shall I repeat the options? Okay. CPAP stand for option A, continuous permanent airway pressure, continuous positive airway pressure, continuous prolonged airway pressure. Option D, continuous passive airway pressure. Option D is your answer. Yes, it's a correct answer. You got the 10 points. Now let's move towards another question. The next question is to you. PEEP in ventilator helps to option A, prevent oxygen toxicity. Option B, prevent collapse of alveoli. Option C, avoid overventilators. Option D, helps to prevent ventilator fighting. Shall I repeat the question? Should I repeat the options? You have only 45 seconds. Option B is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. What is the normal range of albumin? Option A, 8.6 to 10.2 gram per deciliter. Option B, 10.2 to 50.2 gram per deciliter. Option C, 3.5 to 5.0 gram per deciliter. Option D, 130.3 to 140.2 gram per deciliter. Option C, 3.5 to 5.0 gram per deciliter is your answer. Yes, it's the correct answer. You got the 10 points. Now, the next question is to you. What is the normal range of bilirubin? Option A, 0.3 to 1.2 milligram per deciliter. Option B, 10.2 to 50.2 gram per deciliter. Option C, 35 to 50 gram per deciliter. Option D, 4.5 milligram per deciliter. Option A is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. Antidote of heparin. Option A, vitamin K. Option B, protamine sulfate. Option C, amiodarone. Option D, adrenaline. Option B is your answer. Yes, it's a correct answer. You got the 10 points. Now the next question is to you. Which route of drug administration provides a rapid response in a patient? Which route of drug administration provides a rapid response in a patient? Option A, oral. Option B, intramuscular. Option C, intravenous. Option D, sublingual. Option B is your answer, sublingual. Option D, sublingual. Sublingual is your answer. Sure? Let's see. Yes, it's the correct answer for the time. Now the next question is, injection of a drug directly into joints is termed as. Injection of a drug directly into joints is termed as. Option A, intra-articular. Option B, intra-arterial. Option C, intravenous. Option D, intrathecal. You have 45 seconds. Option D, intrathecal is your answer. Sure? Lock कर दिया जाए? Let's see. Sorry, it's the wrong answer. I would like to pass this question to you. Shall I repeat the question? Option A, intra-articular is your answer. Yes, it's the correct answer. Now, I would like to ask the next question to you. Where is adrenal gland located? Option A, near kidney. Option B, near heart. Option C, brain. Option D, near lungs. Option A, near kidney is your answer. Yes, it's the correct answer. You got it 10 points. The next question is to you. Which gland controls the functioning of other endocrine gland? Option A, thyroid gland. Option B, pituitary gland. Option C, pineal gland. Option D, adrenal gland. Just a minute, I would like to change this question. So you guys just wait it for 1 second. The question is to you is asthma is a chronic disorder that causes. Asthma is a chronic disorder that causes. Option A, pneumonia. Option B, skin rashes. Option C, heart blockage. Option D, inflammation in the airway. Option A, pneumonia is your answer. Sorry, it's the wrong answer. Option D, inflammation in the airway is the correct answer. Anyway, you will try very well. Now the next question is to you. Okay. The question is, bleeding time ranges from option A 30 seconds to 1 minute, option B 0 to 1 minute, option C 1 to 3 minutes, option D 2 to 5 minutes. Option A 30 seconds to 1 minute is your answer. Let's see. Would you like to share this question? Answer? Okay. Sorry guys, it's a wrong answer. 1 to 3 minutes is the correct answer. Now the next question is to you guys. Are you ready? The question is, what is the clotting time ranges? Option A 30 seconds to 1 minute, option B 0 to 1 minute, option C 1 to 3 minutes, option D 2 to 6 minutes. You have only 45 seconds. Option A 30 seconds to 1 minute is your answer. Sure, लॉक कर दिया जाए. Let's see. Sorry, it's a wrong answer. Option D 2 to 6 minutes is the correct answer. Now the next question is to you. What are the total number of facial bones? Option A 12, option B 14, option C 10, option D 16. Option B 14 is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is, what are the total pair of ribs in human body? Option A 12 pairs, option B 14 pairs, option C 10 pairs, option D 16 pairs. Option A 12 pairs. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. What is the position for anemia? Anemia. And the option A is left lateral, option B supine, option C right lateral, option D prone. Option A left lateral is your answer. Yes, it's the correct answer. You got the 10 points. Now the next question is to you. Best position for a client in hypovolemic shock is option A knee chest position, option B Trendelenburg, option C Paulus, option D supine. Option B Trendelenburg is your answer. Are you sure? लॉक कर दिया जाए. Let's see. Yes, it's the correct answer. You got the 10 points. Now the next question is, difficulty in breathing is called option A dysphagia, option B dyspnea, option C dyspepsia, option D dysphonia. Option B is your answer. Are you sure? Okay, let's see. Yes, option B is the correct answer. You got the 10 points. Now the next question is to you. Presence of fresh blood in the stool is is known as? Option A, hematochezia. Option B, hemoptysis. Option C, melena. Option D, hematuria. Option C, melena is your answer. Sure? Lock कर दिया जाए? Let's see. Sorry, it's a wrong answer. Option A is the correct answer. Fresh blood. Now, the next question is to you. Establishment of Dr. DKU School of Nursing. Option A, 2nd October 2013. Option B, 1st September 2013. Option C, 2nd September 2013. Option D, 1st October 2013.
Dayabai Kanjipai Ukadi School of Nursing.
Establishment of Dr. Dayabai Kanjibai Ukai School of Nursing. Option D, 1st October 2013 is your answer. Sure? Let's see. Sorry, it's a wrong answer. The correct one is option B, 1st September 2013. Now, the next question is to you. Which open surgical procedure for removal of bladder stone? Option A, B&I. Option B, urethrostomy. Option C, cystolithotomy. Option D, cystoscopy. Option C is your answer. Sure? Let's see. Yes, it's a correct answer. You got the 10 points. Now, the next question is to you. Which surgical procedure using cases involving a stone in the renal pelvic? Which surgical procedure using cases involving a stone in the renal pelvic? Option A, SPCL. Option B, pyelolithotomy. Option C, cystoscopy. Option D, URS. Option B, pyelolithotomy is your answer. Let's see. Yes, it's the correct answer. You got the 10 points. Now let's see what's the score. So the Bright Sparkle got 60 out of 100 and 5 Star got 80 out of 100. So today's group is 5 Star. So let's give a big round of applause for this amazing team. Hello. Are you happy? Now share some few words on this winning team.
બહુ ખુશ છું અમે જીતી ગયા.
Thank you guys. The rest of the team can take a seat. Well done guys, you played very well. I'm proud of you. And you are proud to a nursing staff. And for PT Savani Hospital. Every day holds the possibility of a miracle. So keep hoping for the best and keep shining. And thank you so much for being a wonderful audience. Goodbye, everyone. Have a very joyful and wonderful day to all of you.
Thank you guys.